Hello physios, I welcome you all to our channel Physio Vidyapit. We are back with our next and the last lecture on ultrasound therapy, and here we are going to study about the dosage of ultrasound, which is very important for the good and fast therapeutic outcomes. Okay, so my name is Vijay Kumar. So let's get started. So the first aspect in our dosage is mode, that is which mode we will use for different conditions. So pulsed mode. In pulse mode, as I have explained in the physiological effect, that there were three types. That is, first was non-thermal, then thermal, then biological. There I have explained that the thermal effect is by the continuous delivery, while the non-thermal is by the application of pulsed. So if in case of acute condition, do we want thermal effect or non-thermal effect? Definitely non-thermal effect, and non-thermal effect is by the pulsed mode. So pulse mode, as it is giving non-thermal effect NTE, so it will be used in the acute condition, while this continuous mode is giving TE, that is thermal effect, so we will use it in the chronic condition. So this is easy and simple to understand as well as remember. Next is frequency. This is very important, and there is something interesting in understanding the dosage regarding the frequency. So in my lecture of electromagnetic radiation, we have studied different radiations. As we were moving from a radiation of lower frequency toward a higher frequency, that is the gamma rays and X-ray, okay, that were at a very high frequency, and I have explained there that frequency is directly proportional to penetration. Okay, which means the higher is the frequency, more will be the depth of penetration. Yes, I have explained the same thing in the electromagnetic radiation part. But here what I have written, you can see that in superficial tissue I am using 3 megahertz. In case of deep tissue I am using 1 megahertz. I am using more frequency at superficial part while less frequency at deep part. This is completely opposite to the concept that we have earlier made. Why so? The reason behind this is that attenuation of ultrasound is increasing as frequency increase. अब attenuation क्या है? For this I have explained it in my previous lecture. Attenuation means the different mechanism by which loss of ultrasound energy is taking place, and it was by reflection, refraction and absorption, which means higher is the frequency, more is the loss, and that loss is equal to attenuation. And how that attenuation is occurring? By three main mechanisms: reflection, refraction and attenuation. So due to this, the 3 megahertz is undergoing a lot of attenuation, so it could not reach deep inside the tissue. That is why it is used in superficial lesion, while the 1 megahertz frequency is having less attenuation. इसका लॉस इतना ज्यादा नहीं हो रहा है एनर्जी का, और ये डीप इनसाइड द टिश्यू तक पेनिट्रेट कर सकती है. दैट इज व्हाई इट इज यूज्ड इन द डीप टिश्यू लीजन्स. ओके, so this is important. Ultrasound attenuation increases with rising frequency, so lower frequency penetrate further and have greater depth of penetration. Next, the thing which is important is that if I am saying that this 3 megahertz is having more attenuation, okay, that is the same thing which is written. If 3 megahertz is having more attenuation, it means that reflection, refraction and absorption is occurring more by the 3 megahertz ultrasound. Yes, definitely. And among reflection, refraction, and absorption, the most excess or the larger amount of attenuation is produced by absorption. And do the ultrasound absorption lead to heating? Yes. So if lot of attenuation is occurring by the 3 megahertz ultrasound, definitely there will be lot of absorption and definitely there will be heating. So it may cause burn if we are using higher intensity. So can we say that if we are using 3 megahertz, the intensity should be less as compared to 1 megahertz? Yes, we can say. This is what is the main concept. But I have explained कि जो 3 मेगाहर्ट्ज है उसमें एटीन्यूएशन ज्यादा है. एटीन्यूएशन मतलब उसका अब्जॉर्प्शन, रिफ्लेक्शन एंड रिफ्रैक्शन बहुत ज्यादा है. और इन तीनों में से भी जो चीज डोमिनेट कर रही है वो क्या है? इट इज अब्जॉर्प्शन विच इज डोमिनेटिंग. एंड क्या अब्जॉर्प्शन हीटिंग करेगा टिश्यू की? डेफिनेटली करेगा. और क्या हीटिंग से बर्न होगा? This you know very well. Yes, it can cause burn. So in case when you are using 3 megahertz as the frequency, you need to have lesser intensity as compared to 1. Due to which there is a thumb rule that if you are using 1 megahertz at 1 watt per centimeter square intensity, that is frequency is 1 megahertz and intensity is 1 watt per centimeter square. What will be your intensity when you are using it at 3 megahertz? At 3 megahertz, just divide it by 3. So 1 watt per centimeter square divided by 3 will be 0.3 watt per centimeter square. So that is why the lesser intensity is used in 3 megahertz ultrasound. Why? To prevent any kind of burn. Why? Because more attenuation was there in the 3 megahertz ultrasound. So this is the main concept regarding frequency. Rather it is simple to understand. In superficial use 3, in deep you use 1 and finished. But you need to understand the reason. I have explained a lot of time. 3 answers you must have for one question. What, why and how. Okay, what is the answer, why it is the answer, and how, what is the explanation regarding that answer. Next is the intensity, which is again very important, very interesting to understand. But this you will understand if you have watched my previous lecture in which we have studied about SATA and SATP. That is very important because a lot of mistakes occur in case of ultrasound application regarding the intensity. See, this is a ultrasound modality. I am drawing a ultrasound modality. This is the display of ultrasound and it will display some intensity, and this is the knob which I will turn to increase the intensity. This is the coaxial cable, and here I am drawing a transducer head. Okay, so let us understand. You need to understand one main thing. The value which you can see on the display of ultrasound, that is when you will turn this knob and try to increase the intensity, definitely some value will be showing on this display. Yes, definitely it will be showing, sir. And this value is the value of SATP. SATP. Okay, that is good. And there is a difference in only the acute condition, which means if I am saying for continuous mode, SATP is equal to SATA. See, SATA is equal to SATP when CM, continuous mode. Continuous mode के लिए ये चीज same है. Then what is SATA? First of all, you need to understand this. So it is the intensity which is emitted by the transducer head. This is SATA, and this what is displaying is SATP. Okay, so let us feel it by the practical part. I increased the intensity. Mode is, till now the mode is continuous. I am explaining for continuous mode. So I increased. The intensity is 0.1, which is SATP. And what intensity will be emitted by our transducer head? It will be also 0.1. Then I again increased the intensity. Here comes 0.2. Here also intensity will be 0.2. Then I again increase the intensity 0.3. 0.3. So here the conclusion is that what you are giving, that is you are rotating the knob to increase the intensity, that intensity is only what is emitted by the transducer head. यानी कि जो हम दे रहे हैं वही आ रहा है. सिंपल. ओके, इन हिंदी जो दे रहे हैं वो आ रहा है. What you are giving it is what you are taking. Okay, 0.3 तक घुमाया, 0.3 ही निकला. So you need to just see this part. SATA, SATP and SATP for continuous mode. Okay, 0.1, 0.1, 0.2, 0.2, 0.5, 0.5, 1. So this is about the continuous mode. In continuous mode, you need not to worry. Just give the intensity of treatment. There is not any kind of hard and fast rule. So I have written here, in acute and subacute condition, we use intensity 0.1 to 0.5, or in some books it is up to 0.8 watt per centimeter square. Why? For chronic it is 0.8 to 3 watt per centimeter square, and these are the values of, these both are the values of SATA. SATA is what is emitting from the transducer head, but for making easy, okay, in continuous mode SATA is equal to SATP. So what SATA is what we want from the transducer head, and if in chronic condition it is equal, so then it is easy to understand. So if somebody say that you need to apply ultrasound on the chronic low back pain, intensity is 2.5, you will rotate it up to 2.5. So I will write here 2.5, which is SATP, and SATA will definitely become 2.5. So this is how to understand the intensity in case of chronic condition and in the continuous mode. This was about the continuous mode. But in case of pulsed mode, where we have mark space ratio, duty cycle, and I have explained you the effect of pulsing also. Okay, so you must have the complete knowledge of these two things: pulse mode, continuous mode, and effect of pulsing. Now, what you can see from this graph, initially you were just watching this part, now watch this part. SATP is what I am increasing. So let us say now we are using pulsed mode. So I increased the intensity up to 0.2, and the pulsed mode is 1:1. That is mark space ratio is equal to 1:1, and duty cycle is equal to 1/2 into 100. Okay. So this is SATP what I am increasing. So what will I get from the transducer head? You can see I have given 0.2, but from the transducer head only 0.1 will be emitted. 0.1. Okay, let us move further. When I am giving 1 at 1 I am getting 0.5. That is half. 0.5. Okay. So this is the thing which will occur in the pulsed mode. That is, what we are giving is not what we are receiving. Okay. We want to give SATA, for example, I want it 0.8. Okay. I want it at, let us say I want it at 0.4. Okay. So because in acute and subacute condition, I want intensity to be 0.1 to 0.8. Let us say I have a patient having acute shoulder pain, okay, due to any condition. and I want intensity 0.4, which is SATA. So I will turn the knob here up to 0.4, 0.4, and you can see at 0.4 what will be the value at transducer head. It will be 0.2, but we want 0.4 here. 0.4 तो यहाँ चाहिए था. How we will calculate the SATP value? That is what is missing to understand nowadays, because value which we can see is SATP, but what we want is SATA. So here I am explaining you it with the help of a formula. Okay, so now let us again understand it. Okay, so you need to do one calculation. Okay, one easy and small calculation. So let us have the same patient. We want 0.4 SATA. Let us say we want 0.4 SATA. Now what will be our SATP? That is question mark. Mark space ratio is 1:1. So what was formula? SATA is equal to SATP into duty cycle. We know the value of SATA, which is 0.4. SATP is what we are going to find out. And what will be the DC, that is duty cycle? If mark space ratio is 1:1, then duty cycle will be 1/2. 1/2. So this 2 will come here and SATP will become 0.8. So to get a SATA of 0.4 in case of acute shoulder pain, we need to increase and rotate this knob up to 0.8. This is the main concept, because we want output here, and this dosage is related to this output, not this input. So SATP is acting here as an input. So you need to calculate that what input you need to give to get this output. Again, let us have another example. If we want to give 0.8, so we will change here at 0.8. We will make it as 0.8. So again we want to calculate the SATP. So here I will make 0.8. Pulse ratio is same, and it will become 8 to 16. It will become 1.6. So 1.6 intensity at SATP is what you can see. So you will increase up to 1.6, but you know in your mind that output is just 1:8. 0.8. Why? Because there is pulsing now. The pulsing is what is producing this problem. Why? Because here ultrasound is not coming in a continuous mode. For one time it is coming, then there is a break, then again coming, then there is a break. Okay, so at different mark space ratio, different values. Let us say at this 2.5. So let us prove this 5 and 2.5. So to get the SATA 0.5, so we want SATA 0.5, but here the pain is very much acute. So more is the acute pain, more will be the mark space ratio. Why? I have explained continuous mode is producing thermal effect. Yes, it is producing, this you already know. But pulsed mode is producing non-thermal effect. So you can see that is, if pulse ratio is mark space ratio is 1:1. So one time it is coming, then one time it is not coming. And if I am using it as 1:4, it means for one time it is coming, then 1, 2, 3, 4. 4 time it is not coming, then again one time coming, which means here very less amount of ultrasound will be produced and given to the tissue. So definitely thermal effect will be very much less. So more is the acute pain, more will be the mark space ratio. So in case of more acute pain, you will choose more mark space ratio. So now our patient is having acute shoulder pain, but it is very acute and there is a lot of pain. So it is 0.5 and we want to calculate this. So what we will find, we will put here the value 0.5, and if it is 1:4, duty cycle will become 1/5. 5 5 2.5, simple. 2.5, so 2.5. See, you have to give 2.5 to get 0.5 intensity at pulse mode. This whole thing is for pulse mode acute condition. Chronic, it is simple, you can do whatever you want. Okay, what you are giving is what you are getting. But for acute condition, you need to calculate what you need to give to get this value. Okay, SATA I am making you learn, and SATP you need to calculate for different values. Okay, so this is about the intensity. I tried my level best to make you understand. Please, if you have any query regarding this, you can ask me in the comment section. I will definitely reply you. Then is about timing of ultrasound. It is 5 to 10 minutes for one treatment area. So you will say, sir, what is our treatment area? Treatment area is the area double as to the transducer head. So if the transducer head is having this area, so the area double to the transducer head. So this is our one treatment area, and here we can apply ultrasound for 5 to 10 minutes. It is 5 to 10 minutes per treatment area, and treatment area is equal to twice the area of treatment head. Upper limit is 20 minutes, and longer time is needed for healing purpose. That is, either it is fracture healing where we were using lipus, okay, and for increasing the extensibility of collagen. Okay, so this is about the dosage of ultrasound. So if you are having any doubt regarding this, you can ask me in the comment section. And please, if you are not able to understand this numeric part, please repeat it one or two times. Definitely you will understand. Okay, so with this we are finishing ultrasound. In our next lecture we will study about phonophoresis. Okay, and it is again amazing part related to ultrasound, but there is something new which we are adding into the ultrasound therapy. Okay, so till then you keep on studying. Thank you to one and all.